We're going to talk about the diseases and conditions of the respiratory system. Common signs and symptoms, we have dyspnea, which is shortness of breath, orthopnea, which is what they call positional dyspnea. It's harder for the patient to breathe while lying down, so it's easier for them to breathe when they're sitting up. Ortho means straight. Apnea is the absence of ventilation. Hypoxemia, reduced oxygen in the blood. Hypoxia, reduced oxygen in the tissues, and abnormal breath sounds such as wheezing and crackles. Productive cough, which means they have sputum. Hemoptysis is blood in the sputum. A barrel chest is enlargement of the chest with air trapping. Digital clubbing is enlargement of the distal digits. They have increased venule and capillary pressure due to hypertension. Fluid leaks out, causing fingers to swell, and the nail bed is concave. All right, so the common cold. This is an upper respiratory tract infection, and organs located, the upper respiratory tract includes organs located outside the chest cavity. That's the nose and nasal cavities, the pharynx, the larynx, and the upper trachea. This is an acute inflammatory process. 50% are caused by a rhinovirus. Sinusitis. The sinus cavities are air-filled sacs on either side of the nasal cavity. They are lined with mucus. Three functions of sinuses: they moisten the air we breathe, they lighten the bones of the skull, and they also serve as sound resonance chambers for speech. This sinusitis is an acute or chronic inflammation of the mucous membranes lining the sinuses. An infection causes pus and mucus to accumulate in the sinuses. Pharyngitis is an acute or chronic inflammation of the pharynx. It's also called a sore throat. Laryngitis is an inflammation of the larynx. This causes hoarseness, and this does include the vocal cords. A deviated septum. The nasal septum is off center. The nasal septum is the bone and cartilage that divide the nasal cavity of the nose in half. And so that would be this right here. Okay? And so a deviated septum can make breathing difficult. Nasal polyps are benign growths. They form as a consequence of distended mucous membranes protruding into the nasal cavity, and usually form around the area where the sinuses open into the nasal cavity. Large nasal polyps can block normal drainage from the sinuses and can lead to sinus infections. Epistasis is another name for that, is nosebleed. The anterior portion of the nose is called, you have Kesselbach's plexus, and this is located over the anterior nasal septum, and that's this part right here. So this is more common, less serious, okay? The posterior portion, okay, of the nose, the sphenopalatine artery, right in here, okay? This is less common and it's more serious, may be asymptomatic or manifest as nausea, hematemesis, anemia, hemoptysis, or melena, and it's caused by trauma to the nose. Hemoptysis is coughing or spitting up of blood from the respiratory tract. Atelectasis is the collapse or deflation of the individual alveoli because of inactivity or failure to take deep breaths. It's caused by obstruction of the lung by foreign matter, a mucus plug, or excessive secretions. This is an airless condition of all or part of a lung that allows unoxygenated blood to pass unchanged through the area. This produces hypoxia. A pulmonary embolism is a blood clot or other material that occludes an artery in the pulmonary circulation. It's usually caused by a blood clot in the leg that travels to the lungs. Pneumonia is when the alveoli become inflamed and filled with fluid. The alveoli are filled with fluid, keeping oxygen from reaching the bloodstream. May involve a single lobe, it's called lobular pneumonia, or both lungs, just bilateral. Streptococcus pneumonia and influenza viruses are leading causes of pneumonia. A pulmonary abscess is a cavity of contained infectious material in the lung. Legionellosis it's caused by Legionella pneumophilia. This is not contagious. Legionella pneumophilia thrives primarily in warm aquatic environments. It becomes problematic when they infect cooling towers of air conditioning systems and the hot water plumbing of buildings. Now, the two types are Legionnaire's disease, and this is a bronchopneumonia. It's named after an epidemic outbreak of the disease that killed 34 people and sickened more than 200 attending an American Legion convention in Philadelphia in July 1976. And the milder form is Pontiac fever, and there's no pneumonia associated with that. But remember, this is not contagious. RSV pneumonia, this stands for respiratory syncytial virus, and it typically mimics the symptoms of a common cold. Now, the syncytium is a biological structure that looks like a cell, but is actually a mass of cytoplasm. The RSV causes the syncytium to develop in the lungs where this is abnormal. An RSV pneumonia is an inflammatory infectious condition of the lung. This is highly contagious. Most common cause of bronchiolitis and pneumonia in children less than 1 year old. And most children have been infected with the virus by age 2. Histoplasmosis, this is a fungal disease. It's caused by inhaling dust contaminated with Histoplasma capsulatum, and the primary lesion is in the lung. Influenza. Now, this is an RNA virus. It's the Orthomyxoviridae family. It's contagious. It's a respiratory illness caused by influenza viruses. Causes a mild to severe illness, and it can lead to death. Okay? Now, I just want to go over this. So this is what you need to know for your test, but I want to explain this because you hear all the time H1N1 or H1N2, stuff like that. Well, let me show you how they get that. The RNPs, this is RNA plus a nucleoprotein. Okay, and this is an influenza A molecule. Okay. So the NA and HA right here are glycoproteins, and they're integral proteins. Sorry. Okay, now the HA gene right here encodes the hemagglutinin, and that's what binds to epithelial cells of the respiratory system. H1, H2, and H3 are found in human infections. 13 others have been found in animal flu viruses. Now the NA gene right here encodes neuraminidase, which helps fresh virus to bud off from the plasma membrane of the cell. N1 and N2 in human infections, 7 others in other animals. Okay? Now the flu viruses change in 2 ways. They can have an antigenic drift, and these are small changes in the virus that happen over time. Produces new strains that may not be recognized by the body's immune system. It's due to mutation, and it results in sporadic outbreaks and limited epidemics. Now, the second way that the flu viruses change is an antigenic shift. This is an abrupt major change in influenza A virus, results in a new subtype or a virus with an HA or HA/NA combo that has emerged from an animal population that is so different from the same subtype in humans that most people do not have immunity to the new or novel virus. You get an epidemic or a pandemic. It's due to reassortment. An antigenic shift probably results from genetic recombination of a human and animal strain of influenza. So in the spring of 2009, we had that H1N1 virus that was getting a lot of people sick. Okay, so again, this is the influenza A virus. This is the Orthomyxoviridae family. Now, the paramyxoviruses, this includes the parainfluenza viruses, measles virus, and the RSV. They do not undergo antigenic shifts. Just FYI. Okay. Chronic obstructive pulmonary disease. This is also known as COPD. It's a slow, irreversible, progressive airway obstruction. The patient is unable to freely ventilate the lungs, and there's an ineffective exchange of respiratory gases. The patient develops smaller air passages and have partially destroyed alveoli. Air passages also become clogged with mucus. The two most common conditions that contribute to COPD are chronic bronchitis and emphysema. The most important risk factor is cigarette smoking. Bronchitis is an inflammation of the mucous membranes of the bronchi, and chronic bronchitis is almost always caused by smoking. Okay, you have that thick mucus, damaged cilia. Emphysema is a slow progressive destruction of the lungs. You have destructive changes in the alveolar walls, an irreversible enlargement of the alveolar air spaces. Alveoli are damaged. When air sacs are damaged or destroyed, their walls break down and the sacs become larger. These larger air sacs move less oxygen into the blood, which can leave a patient feeling short of breath. Once air sacs are destroyed, they cannot be replaced. So let's stop here.